Have you ever wondered what precum is and what it does? If you're curious about this natural bodily function, you're in the right place. Precum, also known as pre-ejaculate, pre-seminal fluid, or Cowper's fluid, is a clear fluid that comes out of the penis during arousal but before orgasm. Much like its cousin, semen, it's one of the several sexual fluids produced by someone with a penis. Precum, however, is made in the Cowper's glands. These are a pair of pea-sized glands located behind the penis on the inside of the body. Now, while semen is known to contain sperm, precum usually does not. It's primarily composed of nutrients and other substances that help keep semen healthy. However, it's important to note that sperm can still find its way into the fluid as it's leaving the body. This is where things get a bit scientific. You see, sperm cells can be killed by urine because the pH level of the fluid is more than sperm can live in. Given that ejaculate and urine leave the body through the same tube, it's possible that sperm can be affected by its acidity level. But here's where precum steps in. Pre-ejaculate can neutralize the acidity or make it more alkaline in the urethra, which clears the way for sperm to travel through it safely. In this way, precum is also a natural lubricant for sexual intercourse, similar to the fluid that's made by people with a vagina when they are aroused. You might be wondering how much precum is normal. The truth is, there's no normal or abnormal amount. It varies from person to person. On average, most people leak up to 4 milliliters of fluid. And just to clarify, a person does not control how much precum is released, or when it comes out. Now, let's address a common concern. Can you get pregnant from precum? The chances are low, but it's not impossible. Precum does not typically have sperm in it. However, if the fluid travels through the urethra soon after a person has ejaculated, sperm can be picked up. In fact, studies have found that if a person has intercourse after a recent sexual encounter, precum can mix with sperm that was left behind in the urethra. In one study, 41% of people had precum that contained moving sperm, suggesting they would be capable of reaching and fertilizing an egg. This fact underlines why the pull-out method, or withdrawal, is not a reliable way to prevent pregnancy. A 2017 study found that the withdrawal method had a 20% failure rate. In conclusion, precum is a natural bodily fluid that serves a vital function in the male reproductive system. It primarily acts as a lubricant, neutralizes the acidity in the urethra, and can potentially carry sperm, although the chances of pregnancy from precum alone are low. However, it's always wise to use reliable contraception methods to avoid unwanted pregnancies.